Two.
This meeting is being recorded.
Hello, everybody. Good afternoon, and welcome once again to a weekly media briefing and public health update with Montgomery County Executive Marc Elrich. I'm Lorna Virgili, Hispanic Public Information Officer, and joining us today are Health Officer Dr. Keisha Davis, as well as Mr. Sean O'Donnell, who is Program Administrator, Public Health Emergency Preparedness and Response for the Department of Health and Human Services. Dr. Earl Strider, our Assistant Chief Administrative Officer, is also joining us, and we have three special guests today. We have Jeru Bande, who is the Director of the East County Regional Services Center, as well as Harriet Shangar, and she is our African Community Liaison out of the Office of Community Partnerships. They're here to talk about African Heritage Month. And we have Dr. Robert Kaufman, who is a psychiatrist as well as a Navy veteran. He's here to talk about Suicide Prevention Month. And with that, I toss it to you, Mr. County Executive. Good afternoon. Great to see you.
Good afternoon, and thank you. Thank you for joining us again today. Montgomery County was founded on this day in 1776. So this is our 247th birthday. And so we're celebrating it with another day of historically high record heat for early September. I hope everyone in our community is taking the proper precautions, taking breaks if they must work outside, and drinking plenty of fluids. And most importantly, checking in on our family, friends, and neighbors, especially the elderly, to make sure they're okay. This was the headline on CNN this morning. The world has just experienced the hottest summer on record by a significant margin. And this graphic was alarming. Basically, you can look at different years on that scatter graph. And while things have consistently been getting higher, this last summer just jumps right away from the trend line, and it is pretty alarming. If this summer isn't a reason for all policy makers in every community in this nation, this state, and on earth to get serious about this and to get serious quickly, we need to accelerate our efforts to combat climate change. And if this doesn't make you serious, I don't know what's going to make people serious. I understand a lot of the angst that you hear from young people. When I grew up in the early 60s, and a lot of us grew up knowing that there was this cloud of nuclear war over our heads. We ducked and covered in our classrooms. They told us which wall to stand against in case there was a nuclear blast. And I, can assure you, and I know those of us who went through that, it certainly added a level of anxiety to our lives. And I think about the young people, and I talk to young people who are very distraught about the state of the climate, where things look like they're going, and what they see is either total inaction or not enough action on the part of adults who are the ones in a position to do something about this. And this anxiety is playing itself out in the young community. We may not all realize it. They may not come and talk to us as elders and say, hey, I want to tell you how bad I feel about this. But if you probe with a lot of them, they'll talk about their fears about the world and where this is going and what it's going to mean for them. This is not a good way to grow up. And I hope we can think beyond ourselves and think about our children and our grandchildren as we make some of the hard decisions we're going to have to make in order to fight climate change. The good news is this record heat looks like it's going to break by the weekend. And we'll get some needed rain as well. I hope the rain doesn't dampen our first weekend to some very important and popular fall festivals. The annual Silver Spring Jazz Festival is on Saturday. And on Sunday, Salvadoran culture will be celebrated at the Montgomery County Fairgrounds. That annual show draws thousands of people to honor El Salvador's Independence Day, which is September 15th. This month is also African Heritage Month. Last night, I was a special guest at an event to proclaim and celebrate African Heritage Month. I shared my thoughts on the tragic legacy of colonialism and the persistent struggles of neo-colonial exploitation of the land, resources, and people. And it's important that we understand this history and we talk about it and we realize that it still impacts our world today. I'm not going to go into everything I said last night, but I think, as a lot of people look at Africa and wonder, about its state of underdevelopment, I think we have to remember they were developed to be exactly what they were by the white colonial governments that ruled Africa. African countries didn't emerge from colonialism until late 1950s and early 1960s. They were exploited. What Europe did to them was what England did to Americans, if you want a reference point that maybe we can all relate to. Americans rebelled against the British because the British insisted that we export all of our raw materials to England and allow factories in England to produce the finished goods, which they then sold to English and European customers. Africa was used, first of all, to export labor. We basically enslaved people and forced them into servitude in the Western world. But we also, after that was done, continued to extract resources, agricultural and minerals from the African continent under colonialism. And those raw materials, for which very little wound up in the hands of Africans, were sent to the European powers. They created great wealth for European companies and left Africa impoverished. And when the Europeans were finally kicked out around 1960, they pulled out all of the white workers who worked there. They left these countries uneducated because they were very careful to make sure they did not have a populated education who might ask for too much. And they left these countries just hanging there without the skills, without the capital resources, and in a position where the only thing they had to do is to continue to sell their raw materials to the Western world. So when we think about Africa, we have to understand the role that the West played in creating the conditions. And a lot of people like to look at the conditions and make this a reflection of Africans, and really what it is a reflection of what white people did. And we ought to be honest about that. And I know this may be causing Ron DeSantis to roll in his bed sleeplessly, but that's not my problem. I was also pleased to announce that through a county grant, we're able to host PanaFest in Silver Spring on September 23rd. This is an incredible event that draws thousands from our region to celebrate Montgomery County. It's a great festival. I look forward to attending again, and it's also good news for our local businesses. Our African diaspora is very diverse and can't be viewed or engaged with homogeneously. The community consists of 54 different African countries, along with many different tribes and sects within those countries. Out of all of the county's immigrant groups, the African diaspora consists of the most ethnicities, most languages, and largest diversity of cultures. This is one of the fastest growing immigrant communities in Montgomery County and in the state of Maryland. Our East County region has the largest overall immigrant population out of the 5 regions of the county, with the highest concentration of our African immigrant communities. Today, I'm joined by Jeru Bande, who is the director of East County Regional Services Center, and he's also been a really fierce advocate for the East County as well as the African diaspora communities. And our African immigrant communities are also prevalent throughout every community in our county, and Harriet Shangar is our African community liaison out of the Office of Community Partnerships and is our dedicated county employee who works with and helps serve the needs of this community. I wanted to have them both on to share a few minutes about the community, their concerns, and some of the upcoming events this month. So I'll turn it over to you, Jeru and Harriet.
Thank you, Mr. County Executive. Jeru Bande, the Regional Director of East County. First of all, on behalf of the African community, we would like to thank you for the profound historical background you provided on Africa, the pre-colonial, colonial, and the post-colonial era, and the impact those relationships continue to impact not only Africans on African soil, but for many of us in foreign lands, including the United States. We also appreciate your commitment over the years and the preceding administrations for your commitment to making sure the African community continues to be welcome in Montgomery County. Obviously, everyone knows throughout the world that Montgomery County is welcoming of very diverse cultures, ethnicities, ancestries, heritage, faiths, and communities with different abilities. Thank you very, very much also for continuing to make Montgomery County shine as the first county to proclaim September as African Heritage Month, beginning in 2008. For the world now knows that in Montgomery County, we celebrate African Heritage Month in September to pay tribute to the history, to the heritage, culture, ancestries, values, and contributions of the African community, which also continues to enrich our diverse communities, diverse county here in the state of Maryland. We celebrate this by honoring the achievements and the contributions and partnerships, our relationships, and how we continue to do whatever we can to change those circumstances, as you narrated yesterday, as a result of the lingering colonialism and neocolonialism in our home states. We appreciate you and the county government, and we continue to work as residents of Montgomery County through partnerships and by enhancing our community engagement, volunteerism, advocacy as a community, along with other immigrant and diaspora communities, and particularly with the African communities who we share ancestry, heritage, and many other commonalities. I will at this time turn it over to Harriet Shangar, who is our liaison in the 5 regions. Harriet?
Thank you, Mr. Jeru. Good afternoon, everyone. First, I would like to thank the county executive very much for his amazing gesture yesterday. The community is very, very happy. They are very excited to have you for the whole evening. Not only that, but your support for the Panafest means a lot, because the times that Africa is in right now, we really need that voice, the unifying voice across the community here, to realize that our journey to this place and the home that we have found, we need to speak with a unified voice and put our differences aside in order to move forward and have a community of people who are willing to grow and to benefit from the opportunities that are in this country, and hopefully that will translate to the major vision that we have for Africa as a whole. So I do work as an African community liaison, and primarily my job has been to promote community engagement and civic participation, because it's so important that our voice is also heard, and also being able to shape the policies that can address our diverse needs. And so far, post-COVID, we have seen a significant influx of socioeconomic disparities, including mental health crisis in the community. And I'm happy that September is a month that we're able to speak and advocate about suicide prevention and mental health support. Other than that, I'm happy to continue working with you, promote community wellness, and also support small businesses, provide more resources, information, and awareness of county resources and support. Thank you.
Thank you very much. Members of the media, we're going to open the Q&A portion of this presentation. So if you have any questions for Director Bande or Africa Community Liaison Shangarai, this is the time you raise your hand and ask those questions regarding African Heritage Month. Any questions regarding this particular topic? Go once, twice. Okay, I guess no questions from members of the media. Thank you two, for joining us this afternoon. You can stay for the remainder of the media briefing, or you can drop off if you have to go. Mr. County Executive.
Okay, thank you, Harriet and Jeru, for talking a little bit to everybody today. Every September, we acknowledge National Suicide Prevention Month. Suicide is a very difficult issue to talk about, let alone prevent. But the most recent data shows Montgomery County's mortality rate, the number of people who are lost per 100,000 people in our area, is lower than the state average, but as with many hard to talk about subjects, having no deaths due to suicide would be an even better outcome. It is good that it's low. It could be lower. Last summer, a nationwide suicide prevention crisis line, 988, was launched to make it easier for people to remember the 3-digit number and call for help. It provides a direct connection to support for anyone experiencing a mental health crisis, having thoughts of suicide, or worried about someone else who may need crisis support. county's 988 call line, run by everybody, is accessible 24 hours a day and is available for English and Spanish speakers. In the years since 988 was launched, over 300 Montgomery County residents called for help, and trained staff are ready to take your phone calls or text with somebody who needs support. One group that we've seen impacted by suicide are military veterans. It's why one goal of Montgomery County's Commission on Veteran Affairs is making sure that services like mental health help are easy to find. For veterans, their time in service can be highly stressful, but letting that stress go can be another struggle entirely. When I was growing up, I knew a couple of people who came back from Vietnam, and the impact of that war lasted far longer than the time they probably spent over in the war. So we know the kind of struggles veterans go through. I'd like to invite a psychiatrist and 32-year-old Navy veteran to 32-year Navy veteran to talk to you about this topic. Dr. Bob Kaufman is a retired Navy Medical Corps captain and continuing to serve active duty and veteran populations as military and veteran liaison for Sunstone Therapies. Dr. Kaufman capped his career in uniform as the first chief of clinical operations at the National Intrepid Center of Excellence, located on the Walter Reed campus in Bethesda. And he currently serves as vice chair of the county's Commission on Veterans Affairs. So, Dr. Kaufman, talk to us.
Thank you so much, Mr. County Executive. It's a pleasure and honor to be here to talk about this incredibly important subject, which I'm sure our county citizens can appreciate, that we are blessed with a very large number of veterans in our county. There is a little good news to report. The suicide rate for veterans has fallen, and it's the first time the suicide rate for veterans has fallen since 2006. There are now about little less than 16.8 to be precise, veterans who take their life each day, and that's we've heard about the 22 a day. That number really is more consistently 20 a day, and that's counting active duty members as well. So for the suicide rate to fall to less than 17 is a positive sign that the additional mental health care and support services that veterans are getting is saving lives. It's important to realize, Mr. Elrich, that veteran suicide rate is twice the national average. And so there, as you know, veterans, whether they deployed or not, continue to experience ongoing transition issues, which the Veterans Affairs Commission here in Montgomery County is taking for action. There is a effort to reduce national suicide by 20% by the year 2025, and that is under the aegis of the National Action Alliance for Suicide Prevention. And there is actually a national strategy for suicide prevention, which in part has been responsible for the reduction of suicide that we've seen fall from 20 to 17. And I have included that toolkit for the community in this chat, or will be sent out separately. Interestingly, it really is collaboration, particularly with the communities, that is dropping the suicide rate. Mr. County Executive, I don't know how many people are aware, but in 2022, Senator Elfreth passed HB 709, which actually was a radical, at that time, plan to increase psychedelic assisted therapy spending for research. I'd like to take a moment and update your audience as to what's going on in the psychedelic assisted psychotherapy world. I am actually a therapist at Sunstone Therapies now that is actually leading the charge in the delivery of psychedelic therapy in the medical setting. We're focusing on the development and execution of clinical trials. And I'm going to leave a link to Sunstone Therapies because there are many opportunities for both veterans and general population individuals to enroll in these all-important clinical trials so that when psychedelics are approved, and ketamine has already been approved, I'm going to be talking about that here in a moment, but when MDMA is rescheduled, and it's anticipated to be next year, as well as psilocybin, we will have the data and the science for safe and effective treatments. But it's important to realize that we do have currently, we do have evidence-based treatments that are safe and effective for PTSD and major depression. Unfortunately, they don't work for everyone, which is why we really need to continue doing the kind of research that we're doing at Sunstone Therapies and leading the way so that individuals can have choices when it comes to the primary causes for suicide.
Thank you, Dr. Kaufman. Are you done with your presentation?
Well, I want to be sure to leave some time for Q&A. I don't know how much time we have. I'm hoping there is incredible interest right now in psychedelic assisted therapy. As I mentioned, Maryland has taken this seriously by passing legislation to give researchers like me and Sunstone Therapies opportunities to do this all-important research. You know, for 60 years, the research on psychedelics has really been stalled. And now that we are what is considered to be sort of the psychedelic renaissance, this research is so important right now so that we can move out smartly and safely.
Thank you, Dr. Kaufman. Members of the media, any questions at this time regarding this topic in Suicide Prevention Month? Please raise your hand, use the chat. Raise your hand here. And okay, there is Katara Jones. Good afternoon, Katara.
Hi, good afternoon.
Sturgis Community Television. Go ahead.
Yes, this is for Dr. Kaufman. How can Montgomery County residents support military veterans who are transitioning to being out of the military and now back at home? How can, average, county residents really support them in their healing journey?
Thank you, Katara. This is a very important question, and it's a simple answer, but it's a difficult one to carry through, and that is to remain connected with that veteran. We know that isolation and despair and loneliness are really the precedents to suicide. The toolkit that I shared earlier will have some opportunities for community engagement to accomplish that all-important connection with veterans, but to include just simple things as to how to engage a veteran in communication about his or her personal story and experience.
Thank you, I appreciate it.
Thank you, Katara. Members of the media, any other questions for Dr. Kaufman?
Lorna, while we're seeing if there are any more questions, let me just add that in my 35 years of being a mental health provider, one of the most exciting areas that I just mentioned in terms of psychedelic assisted psychotherapy is the treatment of the wounds of war, significantly TBI and PTSD, with psychedelics. And we are actually enrolling veterans for various studies at Sunstone Therapies. And this truly is cutting edge. And it's wonderful that Montgomery County and Sunstone is actually part of the Shady Grove Adventist Hospital. So it's really exciting to know that Rockville is leading the way.
Thank you, Dr. Kaufman. Members of the media, any more questions for our guest today? No questions? Thank you, Dr. Kaufman, for joining us. Mr. County Executive, do you want to say goodbye to him?
Yeah, I want to thank him, both for your service, but both for what you talked about today. I know that, research on psychedelics going back to the 50s actually indicated, possible mental health clinical benefits. And the obsession that some people had with Timothy Leary and people like that led to a shutdown of research and everything else. And it's really tragic loss because, you're reading in the last few years about real benefits, for example, for alcoholics and being able to get people to move away from alcoholism. So there are multiple benefits from the therapeutic use of these drugs. And I'm glad that, we're in a position to help, that Adventist is open-minded enough to house your clinic there, and the state of Maryland has become enlightened enough to look at this the way it should be looked at, as a really potentially beneficial therapy that could help a lot of people who need help. So I wish you luck in your studies. I hope you find more people who want to have that clinical experience. It will make a lot of people better. So thank you.
Thank you, Mr. Elrich.
Thank you, Dr. Kaufman. You can remain for the duration of this media briefing, or you can drop off if you have patients to see. Thank you for joining us.
Thank you.
Mr. County Executive.
So before we pivot to our health report, I want to thank everybody who came out and braved the very summer-like heat on Monday and came to watch Labor Day parade in Kensington. It was unfortunate that the Gaithersburg parade was canceled, but with the temperatures projected to be in the high 90s, close to 100, it was a pretty reasonable thing to do. And because that parade began later in the day. The Kensington Parade gave everyone on my team a chance to promote the Career Fair and Hiring Expo that's happening at the Silver Spring Civic Building on Tuesday, October 3rd. Many departments are looking for help serving our customers, and the needs vary from engineers to grant writers to mechanics to psychiatrists, therapists, and nurses. We have a lot of vacant positions that we are looking to fill. And so if you know somebody who's got those specialties or interests, please let us know. This Labor Day also gave me another opportunity to thank the men and women who are involved in our local labor unions. Unions do make our county and our country better. We would not have the working class as a middle class were it not for labor unions. Unfortunately, history books don't teach very much about the state of labor and the state of communities before unions, and it's no wonder that the companies that fight unions would like to go back to those days, because in those days they had child labor, work weeks that were longer than 48 hours. They didn't deal with paid vacations and sick leave. Basically, they just worked people to death. And we're in a different place now. Unions grew out of decades of these struggles on issues like the exploitation of the workforce, brutal working conditions, child labor, which I am really irritated to see making a resurgence in this country. The 40-hour work week, paid vacations, and sick leave. We owe them so much for improving the quality of life for so many of our people. And I'm really encouraged to see the ranks of unionized workers growing nationally in the face of states that are trying to roll back workers' rights and reintroduce child labor. For all the workers who continue to build this country and this county, whether you're in or out of a union, Labor Day is for you, and I hope you enjoyed it. Last week, about 30 out of every 100,000 people were testing positive for COVID-19 in Montgomery County, just over 15% of everyone testing. It was an increase over the week before and part of a trend that lasted through August in Maryland and here in Montgomery County. With state numbers due out later than usual, it's not clear yet how many more cases we're seeing on average, but we're certainly hearing about more people who know someone who's tested positive. This is not a surprise. School has started and many others are returning to their places of work. But be prepared, but don't panic. Wash your hands regularly. You know that. For those who test positive, the CDC still recommends 5 days of isolation to lessen the spread. And health experts say that doctors and patients should talk before a positive COVID test to map out the best plan for their individual situations. Older adults and those who are vulnerable may be told to go on the drug Paxlovid help lessen symptoms and the duration of the virus, everyone, and I mean everyone, should get the new COVID booster when it becomes available soon. The efficacy of the vaccines wanes. It lessens over time, and we're at a time. I'm at the point since my last shot that it's about time to get another booster. Carry a mask with you in case you need one, such as when you're in an enclosed space where there are a lot of people. It's for your protection and to prevent others from catching it in case you have it but aren't showing symptoms of it yet. And if you know you're vulnerable, and you can ask your doctor if you're unsure yourself, but if you're in the vulnerable population, you would do well to mask up anyway. We don't have a mask mandate. We're not talking about putting one in effect now. But if you're going into crowded places, if you're going to be in a busy store, you're going to be in a movie theater where there are a lot of people, then it would be wise that if you're vulnerable, that you at least wear a mask. Now I'd like to turn this over to Sean O'Donnell, our Emergency Health Preparedness Manager, to go over the week's report before I take your questions. So thank you very much.
Thank you, Mr. County Executive. Okay, I think I'm sharing the presentation now. And just to go over some of the data that we routinely share, the updated projections for the variants is out. Again, these are all XBB subvariants, and there's a wide range of these variants contributing to the illnesses across the United States. The same is true here in Montgomery County. So it's not any one variant at the moment. We've seen a little bit of growth of some of these, but these are all parts of the XBB, which is an Omicron variant. Looking at our wastewater surveillance, we're continuing to see COVID in wastewater specimens at an elevated level, showing us that this is of course happening throughout the county. Looking at test positivity across the state after reporting for a number of weeks of gradual increases, it looks like it's starting to level off at, again, this heightened test positivity. These are for the PCR tests. As we've shared in the past, the PCR testing, it's like a weather vane. It gives us an idea of what direction things are moving, but not the magnitude of what's happening. Within this, though, we've seen, again, from last week, we went from about 30 cases per 100,000 by PCR testing to about 32 cases. So not a dramatic increase, but it continues to creep up. You can see here the different counties' individual transmission rates. These are the daily rates as well as the test positivity. So again, you can see a little bit of the flattening of test positivity over time. Our hospitalization rates in the county have held steady this week compared to last week. Again, about 30 patients in acute care settings, two taking up ICU beds. This is from yesterday's counts. And when we look at the patients who are going into our EDs who leave with a COVID discharge diagnosis, you can see the age ranges are mostly 18 and above, where we've seen increases throughout August and now going into September with people who go to the EDs and have a COVID diagnosis and are discharged. So that again is showing us the increases in COVID cases going to our hospitals. The overall ED visit volume has not changed dramatically over the last few months. It's a little bit different story when we look at the statewide hospitalizations. This number, which is at 266 total hospital beds with a COVID patient across Maryland, is a big jump up from last week. It's a little bit easier to see on this graph here. You can see the daily counts on September 5th showed a spike in the numbers. Fortunately, the ICU cases have not gone up. So these are more, lower acuity patients who are in acute care beds. Again, with just updating the death numbers, we have the August numbers in now across the state of Maryland. There were 66 deaths with a COVID diagnosis. Again, it's showing an elevation from previous months, which is not surprising with the higher cases going up. Again, just want to compare those 66 deaths in Maryland just in August alone to the 69 deaths for the entire year from influenza across the state of Maryland. So again, COVID is still showing more significant illness, and it's affecting far more people than influenza does at the current time. So again, we're recommending caution when COVID transmissions are higher as they are right now. Again, not the same amplitude we saw in previous waves, but there certainly is COVID transmissions occurring now. I just want to remind everyone that yes, we are preparing for the updated vaccine in about a month's time. We still, for those people who have not been vaccinated and would like to get one now, we're still offering those clinics here at Dennis Avenue. And we know that there was a little bit of a delay in getting rapid test kits and masks out to our libraries, but we've been receiving restocks from the state. I know we're getting close to running out again this month. We should have more come in next week, but we still have these at most of our libraries. Free rapid test kits, free KN95 masks. And again, if folks, if you have insurance, it should cover these things. You may have to contact your insurance company or your provider, but they should give you information about that. If you're looking for no cost PCR testing, please use the links through the CDC site that we're sharing here. And there's also test to treat options. With that, I'd like to turn it over to Dr. Davis if she has anything she would like to add from public health.
Thank you, Mr. O'Donnell, for that update. I think it's important for folks to see the numbers. COVID's still here. I know everybody wants COVID to be gone and to not talk about it anymore, but we continue to see blips. This isn't surprising, as was mentioned earlier. For the last couple of years, we've seen kind of a summer wavelet, I would say. I think the thing that is reassuring is that our hospitals are well prepared, and what we are seeing is still pretty mild disease. And so we want folks to be aware, know that COVID is out there, know that it is circulating, and take those precautions. If you are someone that is immunocompromised or elderly or otherwise vulnerable, you may want to consider masking when you're indoors or when you're in a situation where there's not great ventilation. But for most folks, we want you to be washing your hands, covering your coughs and sneezes, testing when you're sick. Don't just chalk it up to allergies. And if you do test positive for COVID, stay home. And when those 5 days are up and you're out and about, continue to wear a mask. One of the things that is really important, we want to remind folks, is that the importance of wearing a mask if you have COVID, so that you're not spreading that to other people that might be around you. And so with that, we will turn it back to Lorna for any questions.
Thank you, Dr. Davis and Mr. O'Donnell. Dr. Stoddard, do you have any remarks today?
I do actually. I want to make sure everyone's aware that this evening down in Silver Spring, and then next week in Wheaton, the Montgomery County Police Department will be conducting community engagement around their Drone as a First Responder program. And so I wanted to encourage both members of the media and members of the public to attend those sessions, hear about the programs, and also provide feedback to the county about how those programs can most be effectively operated, and frankly, be operated in a way that respects people's privacy rights and other concerns that the public may have about those programs. So we're looking forward to having people come down and participate. I'll be there this evening and I'll be there next week. So if you have something you want to share with us, please do attend. That's all I have.
Thank you, Dr. Stoddard. Members of the media, now we open it up for general questions and public health questions as well. Please raise your hand. There you go. Skylar Salz from, I believe, your DC News Now. Good afternoon, Skylar.
Good afternoon. I just had a quick question for Dr. O'Donnell or Davis. I understand that there was a school in Montgomery County that is implementing masking for one of their classes because of an outbreak of COVID cases. So I wanted to see if I could get maybe a comment about that. and about parents not being too happy about having to send their kids to school masked up again.
Sure, thanks for the question. So myself, Mr. O'Donnell, and the public health team has worked in close collaboration with MCPS in the development of their updated COVID policy. And it certainly is reasonable to ask kids who have been exposed to an outbreak to mask for a short period of time. What we have learned from COVID is that what we really want, how kids benefit the most as being in school. And we want to maximize time in school for kids. And masking for a short period of time helps to prevent the spread to other children. It also helps to prevent the spread of other respiratory illnesses. The policy as it is in place is when there is an outbreak in a classroom, that classroom, those kids might have to wear a mask for up to 10 days as a possibility. That is not the entire school, it's not the entire grade, it's isolated to those kids that are affected for the shortest time period that we can do, and that's based on CDC recommendations. So that's what the CDC is recommending. So they are very much in line with CDC guidelines, very much in line with the guidelines that are coming from the Maryland State Department of Education, as well as the Maryland Department of Health. The MSDE and MDH sent out guidance earlier this year, which is what their MCPS's guidance is built upon. So I know it may be an inconvenience for those little ones to wear masks for a few days, but it's much better for them to be in school together, getting that opportunity for learning.
Okay, thank you. That's all I had.
Thank you, Skylar and Dr. Davis. Members of the media, any more questions for our officials this afternoon? No more questions? Going once? Twice? Well, I guess we're done for today. Have a great, safe afternoon, everyone, and we'll see you again next time. Have a good one.